All are requested to please keep video on. Now, so it should be clear that there is no safe anesthetic agents. There is no safe anesthetic procedure. The safe things which is only the anesthetist who is going to give anesthesia. This is a quotation by Robert Smith. So general anesthesia, as you know, it is reversible. It is anesthetic. Anesthesia is, or you can say, chemical restraint, which is reversible process. And the purpose of anesthesia is to produce convenient, safe, effective, and surgical procedure. Main aim of giving anesthesia. Who is this Ashish? Why you are laughing? Ashish Kumar, क्यों हंस रहे हो आप? ज्यादा हंसी आ रही है क्या आपको? वीडियो ऑन करो. Who is Ashish? ऑन करिए वीडियो तो अपना आप. कौन है आशीष? बोलिए, सुनाई नहीं दे रहा है आपको? आशीष के नाम से ये कौन आया है? चश्मा लगाए हुए आप अपना म्यूट करिए. कीप योर माइक म्यूट. अनम्यूट करो, बात करो मुझसे. क्यों आप हंस रहे थे? क्या प्रॉब्लम थी आपको? आशीष कुमार.
हेलो.
हाँ बोलो.
जी सर.
क्यों हंस रहे थे आप?
ऐसे ही सर.
ऐसे ही?
सॉरी सर.
क्लास से बाहर जाइए, आप निकलिए बाहर. तुरंत निकलिए बाहर क्लास से, मैं बोल दिया एक बार. लीव करिए मीटिंग. So the basic purpose of anesthesia and chemical restraint is to minimize, give minimum stress, pain, discomfort, and toxic side effect. So these should be our basic aim for administration of any type of anesthetic agent. And criteria for selection of drugs and technique is also important. Suppose you are going to perform an orthopedic surgery, then in most of the orthopedic surgery, surgeon used to take more time than suppose if you are going to remove a wart or any other thing with the help of this general anesthesia. Then criteria of selection of drug and technique is also important. So different type of surgery require different selection of different type of anesthetic agents. Then species, breed, age, and relative size of the patient. Younger patient require different type of anesthetic combination, while adult animal is required another type of anesthetic consideration. Physical status and specific disease process of the patient. Suppose an animal is having kidney failure, your kidney problem, and you are going to consider, you are going to conduct any type of surgery. Suppose you are going to remove mammary tumor or anything. So be cautious while using ketamine and all the things. Sometimes what will happen if creatinine level is higher? Generally, it happens in case of kidney damage. Creatinine level is higher, and excretion of that anesthetics occurs from this kidney and urine. So if kidney is defective, then the removal of that particular anesthetic agents from the body will be difficult. So sometimes it may become fatal. So suppose an animal is healthy, so fat is higher than a normal animal. You can say 60 kg animals or 55 kg animals are higher than that. So if you are going to give barbiturates, intravenous administration of barbiturates, then what will happen? It will continuously accumulate in the fat, and it will prolong the recovery time. So these type of consideration you have to keep in mind whenever you are going to start any type of surgery, and for that you are going to administer anesthesia. Personal knowledge, personal knowledge is also Already I have discussed operation procedure, and time of the operation procedure is important. Then next one is, this is some definition like acupuncture. What is acupuncture? This type of terms generally used in case of accuse means needle. Needle, puncture means किसी को बुलाना, means stimulation of analgesia by triggering a specific point. Many point is there in the body. Suppose you are interested for analgesia of particular limb, analgesia of stomach, even liver or kidney, then a specific point is present in the body. And by putting that specific point by needle, this technique is known as acupuncture. Then another one is agonist. You know very well about this agonist and antagonist. I am not going to discuss this thing in detail. Then akinesia, this is loss of motor response, usually caused by blockade of motor nerves. So these definition, you please remember it. I will give you notes of all the things so that we can you will keep this in mind for longer time. Then anesthesia. Anesthesia is totally loss of sensation in body part or in the whole body, generally produced by a drug or drugs that depress the activity of nervous tissue, either locally or generally. If CNS depression will be there, then that type of anesthesia is known as general anesthesia. If any particular local or regional part of the analgesia of that regional part is there, then this is known as local anesthesia. This is the difference. And the phases of general anesthesia is basically divided into these 5 parts. That is pre-anesthetics or pre-induction period, induction of anesthesia, maintenance of anesthesia, recovery, and this post-anesthetic period. These are 5 stages of general anesthesia. So remember it. Now local anesthesia. Local anesthesia is limited to local area. Suppose you are interested for amputation of a particular limb or particular, you can say, digit, and you are going to infiltrate that particular local anesthetics around that part. Suppose you are going to remove tail, docking up karna chahte hain, and you are going to deposit this local anesthetics all around this a particular around this tourniquet. Before docking, our basic aim is to prevent bleeding, so you is to put a tourniquet, and over there we will deposit local anesthetics. So analgesia of a limited part, you can say, is known as local anesthesia. Regional anesthesia. Regional anesthesia means if you are going to produce analgesia by blocking sensory nerve. Suppose you are going to remove whole limb, removal of a digit, it can be done by local anesthesia. But if you are interested for regional anesthesia, means you are going to desensitize by blocking sensory nerve of all 4. If you are going to remove 4 limb, and then that is the regional anesthesia for 4 limb. In the same way, this is general anesthesia. General anesthesia, already I have discussed. General anesthesia is CNS depression. Means general anesthesia include 3 important components, and this is very important. You remember these 3 components of general anesthesia. First one is sedation, second one is analgesia, and third one is muscle relaxation. These are the 3 basic components of general anesthesia. By achieving this only, you can go for successful surgery. Suppose you are interested, you are going to perform any orthopedic surgery, and if muscle relaxation is not proper, then it will be very difficult to perform orthopedic surgery. So these 3 components are very important. Always these 3 components can be achieved either by 2 or more than 2 drugs. Means you are going to have a multi-drug approach. Multi-drug approach matlab you are going to use combine 2 or more than 2 drugs, even 4 drugs may be there. So this type of approach is known as multi-drug approach, and by having this multi-drug approach, you are going to achieve all these components, that is sedation, analgesia, and muscle relaxation. If by having this multi-drug approach, you are going to achieve these three components of the general anesthesia, it means that this type of anesthetic technique is known as balanced anesthesia, which is written over here after surgical anesthesia. तो आपको ये समझना है जनरल एनेस्थेसिया के 3 कंपोनेंट्स होते हैं, sedation, analgesia and muscle relaxation. If you are going to achieve these 3 components of general anesthesia by having more than 3 drugs, then this is known as multi-drug approach. And by following this multi-drug approach, this type of technique is known as balanced anesthesia. Balance मतलब सब कुछ balance है, means you sedation भी है, analgesia भी है and muscle relaxation भी है, तो ये balanced anesthesia हो गया. Now next one is surgical anesthesia. So surgical anesthesia is clear. Loss of consciousness and sensation accompanied by sufficient muscle relaxation and analgesia to allow surgery without pain or movement. This is known as surgical anesthesia. Now balanced anesthesia, I have already discussed. Dissociative anesthesia. Dissociative anesthesia is generally achieved by these ketamine, tiletamine. This is dissociative anesthetic. Even phencyclidine is also there. So this is a state characterized by catalepsy. Catalepsy is muscle rigidity, analgesia, and altered consciousness. These are 3 characteristics of this dissociative anesthesia, and these can be achieved by ketamine and tiletamine. Now MAC, minimum alveolar concentration. This is generally used in case of inhalant anesthetics, and this is definition of this. आप लोगों ने फार्माकोलॉजी में पढ़ा होगा. Minimum alveolar concentration of inhalant anesthetics is required to prevent movement in response to any noxious or irritant stimuli. You can say, suppose you are going to incise a tissue. This type of stimuli is known as noxious stimuli in 50% of anesthetized patients. So this is known as minimum alveolar concentration, and this minimum alveolar concentration is used mainly for this inhalant anesthesia. Now antagonist, I am not going to discuss in detail. Catalepsy, already written here, a state in which there is malleable rigidity of the limbs. मैंने बताया stiffness of the limbs, and the patient is generally unresponsive to oral, visual, and minor painful stimuli. So this is the definition of catalepsy, and catalepsy is most commonly seen in case of dissociative anesthesia, which is produced by dissociative agent. I will discuss it later, but try to remember name exactly: ketamine, tiletamine, and phencyclidine. Now central desensitization. What do you mean by central desensitization? The definition is written here: an increase in the excitability and responsiveness of the nerves in the CNS, particularly of the spinal cord or brain. And if this increase in excitability and responsiveness of the nerves is there in CNS and brain, this is known as central desensitization. Now euthanasia, no need to explain this euthanasia. This is, you can say, mercy killing euthanasia. Euthanasia हम करते हैं. It is recommended in veterinary if animal is having severe pain and we are not having any option to treat that type of animal, then euthanasia is recommended. Another term is hyperalgesia. Hyperalgesia means excessive response to pain. If you are going to touch a part of the body of any animal, then it will show exaggerated pain. So this type of exaggerated response to a stimulus, that is even touch stimulus also, that is normally painful to the animal, and this type of this is known as hyperalgesia. In the same way, you can say hypoalgesia. Animal is unresponsive to even many noxious stimuli also. So this type of, if analgesia is there, then that is known as hypoalgesia. Sedation. आप याद रखिए, sedation, hypnosis, narcosis, and neuroleptalgesia. This is very important. Even tranquilizer also. ट्रांकुलाइजेशन, ये चार की आप नोट करिए निडिसिएशन, हिप्नोसिस, नार्कोसिस, न्यूरोलेप्ट एनाल्जेसिया एंड ट्रांकुलाइजेशन. At least you should remember these 5 terms at the tip. जब भी आपसे पूछा जाए तुरंत बताइए आप. These terms are frequently asked when you are going to give anesthesia or you are going to see any type of surgery. I will ask this term: sedation, hypnosis, narcosis, and neuroleptic anesthesia. Already written there. I will give you notes. Don't worry. So these terms are very important. Neuroleptic anesthesia is produced by combination of 2 drugs. That is, one is tranquilizer and another one is analgesics. Like best example of this neuroleptic analgesic drug is Inovarvate. That is combination of fentanyl, droperidol and fentanyl. Droperidol is a tranquilizer and fentanyl is a opioids which gives analgesia. So generally these neuroleptic analgesic is produced by combining one tranquilizer and one analgesic drugs. Now these are some terms which is generally used at the time of anesthesia. Bagged. Animal was bagged. Bagged means one rebreathing bag is there with inhalant anesthetic machine. आप लोगों ने देखा होगा, नहीं तो हम दिखाएंगे आपको. So the basic purpose of this rebreathing bag is to see expiration and inspiration of the animal at the time of administration of inhalant anesthesia. Sometimes we used to squeeze that particular bag to see the something is wrong. Okay. So now attendance, please take attendance and send to me. Prince, Shivam, any one of you please take attendance and please send to me on WhatsApp so that I can send you. I can send over this WhatsApp group. ठीक है ना? Prince.
Okay, sir. Okay.
हाँ ठीक है. Okay. Now term bag means animal is bagged. Animal was bagged means animal was on the rebreathing bed and that animal is attached with inhalant system. In the same way, blocked. The leg was blocked. I have already discussed local anesthetic or regional anesthesia. Means if that particular region, the foreleg or forelimb, is that particular region is blocked, it means that local anesthesia or regional anesthesia is achieved over that particular part. So this region is blocked. And same way bolus. Bolus is, this is term used especially when you are going to use barbiturates. Barbiturates is a type of intravenous anesthetic agents, you know, just to induce anesthesia. Sometimes, many times we used to have this maintenance of anesthesia also, but this barbiturates is having some side effects. So, but this bolus terms is used only in case of barbiturates and intravenous. This is intravenous anesthetic agent. Breathed means if you are going to squeeze that rebreathing bag, or suppose an animal is breathed 6 times, 7 times by using that rebreathing bag. So we used to have this term by breathing at the time of anesthesia. Now Bucking is the term especially used when we used to have animal or even human beings also over ventilator. जब हम ventilator पे रखते हैं, then that bucking is used for that particular thing. Crashed, animal crashed, it means animal has no cardiac CNS and cardiopulmonary function is not good after administration of anesthesia. And this crash term is used when animal is died due to this administration, higher dose of administration of anesthesia. So this condition is called as crashed. Now deep anesthesia, if animal is having apnea sometimes, or respiration and cardiac function is not well, sometimes it may happen due to overdosing of the this agent. So this condition is deep. Down is term just reverse, just same as euthanasia. And dropped also. Extubated and intubated. Extubation means if you are going to put endotracheal tube inside the trachea just for the administration of inhalant anesthesia directly to the patient, means you are going to connect the patient's lungs with inhalant anesthesia machine for the administration of inhalant anesthesia. This means if you are going to insert this endotracheal tube inside trachea, this is known as extubate. Means you are going to, जब आप निकालने जा रहे हैं तब उसको कहेंगे हम extubate. If you are going to insert that endotracheal tube inside trachea, that is known as intubation. And extubation means you are going to, if animal, जनरली हम कब एक्सट्यूबेट करते हैं, कब हम एंडोट्रेकियल ट्यूब निकालते हैं, when animal, generally in case of anesthesia, laryngeal and pharyngeal reflexes was abolished. At that time you used to insert this endotracheal tube inside trachea. But at the time of recovery, when animal used to show coughing, it means that laryngeal and pharyngeal reflexes are coming, and at the same time we used to remove that endotracheal tube, and that removal of endotracheal tube is known as extubation. So this is the difference between extubation and intubation. Extubation हम लास्ट में करते हैं, intubation हम एनेस्थेसिया देने के पहले करते हैं. Preemptive analgesia. Preemptive means the patient received, generally हम कहते हैं patient received preemptive analgesia, means deliberate administration of any analgesic agent before anesthesia. In that just to achieve this analgesic part of general anesthesia, 3 component हमने बताया, उसमें analgesic part achieve करने के लिए, generally in case of orthopedics, in case of abdominal surgery, if you are going to perform, most of the pain receptors is present in skin, periosteum and abdominal cavity में mesentery पे होते हैं. If you are going to stretch that particular part or damage that particular part, then you have to have this preemptive analgesia in your anesthetic combination. Otherwise, what will happen at the time of surgery? Animal will struggle, animal will show excitement, and your surgery may hamper. So preemptive analgesia is very important. Means you are going to use this analgesic agents deliberately before start of anesthesia. This is known as preemptive anesthesia. TIVA is term generally used for intravenous anesthesia. Full form of this is total intravenous anesthesia. Then topped off. Topped off is also used just like bolus, and this is also used for barbiturates also. So these are some terms which you have to remember. Generally मैं आपको बताया हूँ sedation, narcosis, hypnosis, tranquilization, neuroleptic analgesia. These 4-5 terms should be clear. We will send you, I will send you notes of these things over your WhatsApp. आपको किसी को भेज दूंगा और सर्कुलेट कर दीजिएगा, फिर आपको मिल जाएगा सबको, so that आप इसको पढ़ना भी स्टार्ट कर दें. Now time is 2 minutes only. So in next class I will discuss use of anesthesia. Means where you are going to use, what is the purpose of using this anesthetic agent, किस कंडीशंस में हम इस एनेस्थेटिक एजेंट को यूज करते हैं, जो कि जनरली आप रूटीन में आप देखते भी होंगे. तो कोई दिक्कत, कोई क्वेश्चन है? अभी हम ये आई विल डिस्कस दिस टॉपिक इन नेक्स्ट क्लास, सो इफ एनी क्वेश्चन इज देयर प्लीज आस्क। आप बताइए, बन जाएगा? अटेंडेंस ले लिए प्रिंस?
यस सर।